So, I want to start today with a question most DPC doctors don't love sitting with. And if you're a DPC doctor, you're going to know what I'm talking about. What happens to your family if you get sick for 6 months? That is something that a lot of us worry about going into DPC because we're not part of a system any longer. So, this is a very practical conversation that we're having today. This episode precisely came together because that question has become very real as more and more people are choosing to do DPC. And the conversation is happening more and more, especially now in 2026, as more people are no longer able to go to their jobs because some jobs don't even exist anymore for us as physicians. So if you run a DPC clinic or if you're building one, stay with us. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever so relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Maryal Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Welcome back to My DPC Story. I'm Maryal Concepcion, host and family physician at My DPC Story. Today, I'm so excited because I am joined by two amazing people. So first, we have Ashton Casper, who is the president of Zion HealthShare. And we are also joined by Camilla Guerrero, who is a practice administrator at a DPC Brock Family Care in Forest City, North Carolina. So thank you guys so much for joining us today.
Thank you for having us.
As I mentioned already, 2026 is a big black box in terms of we don't know what's going to happen. And we definitely know that things are going to happen when it comes to health insurance, health care, and health coverage, and especially when it comes to access. So this conversation, again, is very intentional. It's about coverage, and coverage does not necessarily mean insurance. It is about values, and it's about the uncomfortable gaps that many DPC doctors don't talk about publicly. And it really does manifest in our clinics when now we're talking to our patients who have questions about healthcare where they never had before. So before Zion was even part of the picture, can you guys share with the audience, what were you guys doing for coverage for you and your families?
Yes, I'll start out. So great question. I have been part of the insurance industry for my whole life, right? When I was a child with my family, as I married and had kids of my own, it was the only option. I think we always just were told that insurance, you had to have insurance. So I joined the health share movement, and my mind has been open to just the options that are out there. And it's been really fun to be a part of this side of it. It's exciting how much joy I get from helping other people realize that there are other options out there besides traditional health insurance. So, I would classify myself and my family as relatively healthy, right? We do annual checkups. Outside of that, we haven't had any major medical expenses for years outside of birth, right? Yes, knock on wood, but we haven't had that for a long time outside of birth. We've been very fortunate that way. So making the move to a health share as opposed to traditional health insurance didn't feel like a huge risk for me because, again, we haven't had any major medical expenses. What was funny is I joined Zion HealthShare as president, but I also became a member at the same time. And about 2 months in, I'm at work one day, and my wife, my phone rings, and my wife calls, and she's like, "Hey, our son just broke his arm." And we're like, "Oh gosh, just fantastic." He was 4 hours away. It was, chaos trying to get him back to us so we could get him where he needed to be. And all of a sudden, it just hit me like, oh gosh, I don't have insurance. All right, let's put this health share to the work, to the test and see if it functions. And I had all the trust in the world. What's funny is I hadn't set up my portal or anything like that yet. I'm a terrible example of being a good member, but I hadn't set up my portal or anything like that. And so I'm at home at this point trying to coordinate all this. I called our support line, just like any other member would have to. Got one of our incredible support agents. Her name is Abby. And she's like, I don't think she even knew it was me on the phone when I said, "Hey, this is Ashton." She didn't put two and two together, but treated me as if I was like the most important person in the world and walked me through, made sure everything was set up. The whole process was so seamless, and it turned a really, difficult, scary situation into something, that gave me peace, because I was reassured that Zion had us taken care of, and everything went really, really smoothly. That situation is not unique. I hear stories like that every day from our members. So it was pretty special for me to see that firsthand, just how important, our mission here at Zion HealthShare is.
Yeah, it's definitely one thing to speak about what you're part of. It's another thing to experience it from, the user perspective. And
Absolutely.
that is definitely something that I know Camilla can speak to as well. So Camilla, I'll turn the mic over to you. I'll ask you the same questions in terms of, what was your coverage like prior to being a member of Zion? And what about the traditional system was what pushed you over into becoming a member at Zion?
Great question, Maryal. So I've always been in the have regular health insurance my whole life, and of course I was like 5 years in administration of a rural health clinic, actually three rural health clinics, and of course I had insurance through work, but it got to a point where I got really tired of the system and I wanted to get out because even I know for doctors, y'all know what I'm talking about, but also in administration, my heart is to help people. And the way things were going, it's more like I was working more for the government and insurance companies than I was working for to help patients. And I just knew there was something better. So when one provider there and I kind of talked at the same time, and we both felt like we needed to found a direct primary care. So we did that move the beginning of 2022. And of course, with that, I lose my health insurance because I don't have a job that can give me a health insurance. I mean, the providers in Medicare age, I'm the only one that would need insurance. It would be way too expensive for the business to provide that. So I had heard about HealthShare and I actually joined one of them, but I heard bad things. But I wanted to join just so if something happened, I was not left, with a situation that, without any coverage. But then through the DPC Summit of 2022 was my first DPC Summit. That's when I heard about Zion HealthShare. And when I started looking into it, I was the first one to join. And after that, more that I learned, I encourage other patients. And right now, I have probably close to 50 patients that have Zion HealthShare. And I just have good things to say. I have many, many examples.
Fantastic. So, just to point out here, for those of you who have heard of Zion HealthShare, and most of us have in the DPC space because we are, always looking for ways to provide access to our patients and not healthcare insurance.
Right.
So many of us know the name Zion HealthShare. But just to add some clarity, especially for those who might be new listeners, Zion HealthShare in particular is a nonprofit medical cost sharing community. So it is not insurance at all. But as you have already heard, it is healthcare access and healthcare coverage when you need it, but it's not through the codes that we all left when we left the system. So members who Ashton and Camilla are members, many listeners are members as well. But basically, if you think about it, it is so representative of our community working together for the better of everybody, right? So Zion is basically like you have members contributing to the pot. And when somebody of any part of that community needs help, that is where a person can then get help from the pot that everybody has contributed to. So that's a very easy way to explain without the medical ease, without the insurance ease of what the core of why Zion exists and how it's helping people. And so when you have patients, when you have doctors, ourselves, who are needing to have coverage for things like broken arms, for things like, the things that we never expected, there is a way to have healthcare access through ourselves as DPC doctors, but for ourselves, this is why we're having this conversation. So here, I want to point out some really common things that people will say when they hear about health shares in general, and especially when it comes to Zion. So I'm just going to rapid fire these to you guys, and then I want to pop them open. So things I'll hear about Zion. Oh, I couldn't join it because this is religious. It only works if you're healthy. They won't allow you to join if you have a chronic disease. This feels risky because it's not health insurance. Another one is it won't work for families. So from there, I want to turn the mic back to you guys. Ashton, if you could start us off with the things that I just mentioned. What is your reaction when you hear that about Zion HealthShare from people who are starting to engage with Zion in the community?
Yeah, I love these. So yes, first of all, I think one of the main misconceptions of health sharing in general is historically it has been tied to religion, right? A ministry, a community that's come together. That's where it was founded. And there are a number of very large health shares that are tied to that have a religious affiliation requirement. Zion HealthShare is not that. We are a faith-based organization. We believe, in a higher power, but we believe that everyone has the right to believe in the higher power that they choose to believe in. And so we are faith-based, but we have no religious affiliation requirements to be a member at Zion HealthShare. So we are inclusive and we're very easy to join. Our process is very simple. There's no underwriting or anything like that. Simply, members can go to our website, prospective members can go to our website and walk through our enrollment process in about 10 to 15 minutes and be up and running and ready to go. So very simple process, not tied to any sort of religion or religious belief, very inclusive, and we are welcoming any and everyone to be part of our community.
I have so many examples that I can give patients if they have those kind of questions and say, no, that's not how it works. Because I have had patients that had pre-existing conditions, and actually Zion, for 3 specific chronic diseases that are very common, like diabetes and hypertension, if it's controlled and you haven't been hospitalized for it, they don't even consider that pre-existing condition. So if something happens to you that's related to that they don't consider that pre-existing condition. Now, a pre-existing condition doesn't mean that they will not let you join. It's just have a phase-in period. The first year they won't cover anything that's related to that specific pre-existing condition. And pre-existing condition is not something that happened to you 10 years ago. Pre-existing condition is something that in the immediate 24 months before you join Zion HealthShare, you have had to be treated for or being seen for. If it's something that happened 5 years ago and you have had no other symptoms or I think that's not considered pre-existing conditions. Now, I have had recently a patient that have had a knee issue for a long time. Of course, that's a pre-existing condition, but he's lived with it for so long. He just waited for until his a couple years until his amount, the cap for the pre-existing condition was lifted, and he was able to have his knee replacements. And I say, Zion, it's not for everybody. I mean, if you, for some reason, have many health issues, I don't necessarily advise you to join Zion HealthShare, but it is a wonderful plan for most people.
To that point, as Camilla had mentioned, we do have kind of a tiered process for providing sharing for those pre-membership conditions. So year 1 is the waiting period. It's $0 for year 1, but year 2 there's a $25,000 maximum per sharing request. So it's per request for one of those pre-existing pre-membership conditions. Year 3 it goes up to a $50,000 maximum, and then year 4 and beyond it's $125,000 maximum per shareable event for those conditions. And those exceptions that we don't consider pre-membership are high blood pressure, high cholesterol, diabetes. As long as you haven't been hospitalized for one of those things in the prior 12 months and you have control of any symptoms or that diagnosis through medication or diet.
Thank you guys so much for that. And again, This is an intentional conversation at the beginning of the year, because this is the time where people are saying, oh my gosh, this is no longer like 2025 and before. This is a different time. And so knowing that this is an option out there for both DPC doctors and their patients is definitely a thing that is driving why we're having this conversation today. Yep. So to the listeners, I say there's lots of questions out there, right? Because healthcare in general, it's hard for us as we work in healthcare every day. But I want to just have you notice, take a moment and recognize you, the listener, what makes you tense about healthcare in general, because I want you to keep that in mind as we're going on. So when you guys mentioned, like Ashton, you mentioned your son having a broken bone, being 4 hours away, and you had to deal with that as a Zion member. Camilla, you've had multiple patients that, have been through your practice as well as you as a member. You guys have had experience as members. Can you talk to us about anything that, may have surprised you or confused you or reassured you the first time you had to, actually use the pot that you were contributing to?
Yes, in 2023, I became pregnant with my first child, and I was already a member of Zion HealthShare. So that was my first test as a patient myself. I just submitted a request through my portal, and it's a very simple process. But also, just so you know, like, because we're talking also to DPC docs, I also help patients if they cannot navigate through their portals and all that. That's what we're here for. I help them with that. But as a patient self, I just uploaded to my portal what I, like my note from the doctor saying, I was pregnant. And they, at the time, it was just your IUA, which was $1,000. Now it's $2,500 for maternity, which is nothing comparison, to sometimes to the out of pocket from health insurances. But I just had to pay that. I paid that actually to Zion because it's easier to that way. You just pay that, and then any bill that I got after that, I just send it to Zion, and Zion paid for it. That was it. I had one situation specifically that surprised me. It was while I was pregnant, I was pumping gas in my car, and I decided to do something stupid and jump the cord, and I fell. And I was okay, but of course, everybody wanted to make sure the baby was okay. So I ended up having to go to the hospital. And so after the hospital, I submitted another sharing request because here I'm thinking, this is not related. But Zion called me and said, we're closing that sharing request because that's related to maternity. Because you didn't go to the hospital to check on your leg or on your arm, you went to check on the baby. So that surprised me. I was very impressed with that because basically anything. And I also had pregnancy carpetano, and that's something I didn't have before. And it was related to the pregnancy. And I had to have a steroid injection, and Zion paid for that too, because it was all related. So it was amazing. I ended up having to have a C-section, and they paid for everything. I mean, 2 months after my son was born, all my bills were paid by Zion. It was amazing. And then, of course, the end of life assistance. One of our patients that recently died, they didn't have any life insurance. So this was a great help to pay for the funeral and help the spouse. Just a couple things like that you wouldn't think that a health share would cover or help with.
Ashton, I see you nodding and smiling, and I'm wondering if you can also chime in here as to things you've heard from members in terms of how they were surprised or how they were reassured when they use Zion for the first time.
Yeah, I smile because I love to hear these stories, right? My career, I've been in healthcare for 12 years. And, insurance has been the bane of my existence because we work so hard to provide care for people, right? Not numbers, people. And it always seemed like we were fighting for every penny. It's not like we were asking for some exorbitant number to be reimbursed. It was we'd love to just be able to pay our staff and keep the business healthy, right? And so I love to hear Camilla's story. I love to hear all of our members' stories and in just how beneficial this is. Going back to a previous question was how scary it can seem coming to a health share. It's a very valid feeling. One of the things that people get scared about is, we help people navigate the healthcare system through a cash pay process. We like to say that we've left the system, and so cash pay, that also requires, or it makes it seem like the member has a major financial responsibility to take care of, right? It could be a broken arm. In my situation, it was about $6,000 total that was that could have been my responsibility. We have situations with members that have had cancer, and Zion HealthShare has helped take care of a bill that exceeded $1 million. That is not a rare thing for us, but we've been able to do that consistently. And the nice thing about it is that we process our sharing requests in under 3 weeks. So as long as the member gets us the documentation, be it a good faith estimate, an itemized statement, any sort of bill, if they've decided to pay that out of pocket, we'll either reimburse it to them within 3 weeks. We can pay a provider directly. We will even issue a virtual credit card to the member to be able to take care of that bill on their own. We provide many options for our members to be able to really relieve them of that financial burden so that they don't have to carry it any longer than they need to. I mean, I think we all have experiences where we've seen like that can prevent, a member getting better or healing, because that financial burden can be so stressful. So we love to be able to take that off of our members. As soon as a member, meets their IUA, their initial insurable amount in the insurance world, that would be like a deductible. Our IUA is a per sharing request or a per situation medical need deductible, but a member is only responsible for those for up to 3 per year. So the financial responsibility is lower for our members if you look at a 12-month period. But as soon as they meet that, that's when the community jumps in and starts to share those medical expenses with our members. And we do it in a very, very quick time frame. For situations like it could be with, if Camilla had a scheduled C-section, she mentioned she had a C-section. She had a scheduled C-section, we can, or any scheduled procedure. My son had to have 2 pins put in his wrist when he broke his arm. We had scheduled that procedure ahead of time. We will actually prepay for those scheduled procedures as well. So that is taken care of beforehand. That keeps the offices, the hospital, the doctors, the offices happy because they're being paid up front. They're not having to chase down money. And it keeps our members happy because it removes that financial burden from their shoulders or from their mind as quickly as possible. And that's what we're there to do.
Amazing. And Camilla had mentioned this earlier, but Ashton, is there anybody who you would recommend, like, you should get Zion or you should not go to Zion because? How would you answer those questions to the audience members?
Camilla mentioned it's not for everyone, right? For those that have illnesses that they are consistently going for treatment or have consistent needs, insurance is likely a better situation for them and for that individual. But I would say that for Zion HealthShare, anyone that is relatively healthy individuals, families, is a great fit for Zion HealthShare. We pair extremely well or partner extremely well with those that are members of a DPC. DPC doctors can be affiliates of ours. Part of that is they revert their patients to us to be members. We can provide an additional revenue stream for the DPC practice through commission based on those referrals. And it was funny, as I was at the DPC summit this year, as I was talking to doctors and I bring that up, probably 75% of them said, "Oh, I don't care about being paid. I just want to make sure that my patients are taken care of or that they have peace of mind for anything outside of my clinic that I can provide for them." And so we can do that too. We can set up that affiliate partnership to be paid or unpaid, but we partner really well with a DPC clinic to be that peace of mind for major medical expenses or catastrophic medical events that happen that can't be covered in the DPC clinic for your patients. So we give doctors, we give patients, we try to provide everyone with peace of mind and just be a great partner for those unexpected events that unfortunately happen more than we'd like them to.
Zion also, what is very different than insurance, which I love, is insurance is from the deductible and out of pocket. It's from January to December. So if something happened to you December 27th and you turn around and you have to have surgery January 5th, you restart all over again. Zion is not like that. It's a 12-month rolling period. So like I've had a situation recently with a patient that there was a finding on their lung, and it ended up through several tests. It was through the end of December and it continued through the beginning of January. They were diagnosed with cancer. Well, they already had met their initial insured amount. They don't have to worry about having to come up with that again. So I think it's a wonderful thing because things happen. You don't have any, and sometimes through the insurance world, you can not use your deductible or for anything until something happens in December. Then you turn around and you have to redo everything again. So I love that part. I think it's very useful. So it has helped patients too.
Fantastic. And Camilla, can you speak to this a little bit more? Because also what Ashton's talking about, that Zion HealthShare pairs very well for DPC patients. We haven't even gotten to the physicians who it helps too. But
Yeah.
when it comes to Brock Family Care, you guys are an affiliate of Zion as well. And can you talk to us about, like, how does that even come up in conversation in terms of helping your DPC members also then understand what Zion is offering, because they might not even know that it is an option.
Yes, it comes up sometimes before they even see the provider, but sometimes in the conversation with the provider, they need a certain test done, or they need a referral, or just different things like that. And many times, she refers them to me, and I talk to them about, because I have many ways of providing cash pay price for an MRI or whatever that's much cheaper than just send him to the hospital or whatever. But many times in conversations like that, and many times they're not just self-pay. Sometimes patients are actually have insurance, but their out-of-pocket expense and deductible are so high that they prefer paying cash. So in my conversation, like I had the other day, somebody was telling me that they pay for a family of three. Of course, they're in their 50s, but their daughter is like 20 something, and they pay through the marketplace, not including the subsidies, just their part. It's like $900, and their out-of-pocket expense for the family is like $16,000 a year. And and you're able to have those kind of conversations. See, I mean, this is like a much better option for you. Of course, you walk through like their specific needs, because there are certain things that, if also like what Ashton was talking about, and we were talking about it earlier, but also like if somebody is expecting to have surgery, they want to have surgery in the next few months, well, then you need to stay with your insurance until you have the surgery, because you don't want to necessarily join Zion, because this is going to be a pre-existing condition, and you're going to have to wait for a whole year. And many times the type of surgery they have, 25,000 is not going to cover it. So there's conversations that have to come up individually for each patient. But this comes up a lot, and I think direct primary care patients, they have a little bit more understanding, just because they appreciate that relationship with the direct primary care, and it works so well like that. And I was going to say something else, because if they go to the Zion HealthShare website, there's two different types of membership. One is essential and one is direct. Well, direct membership is for patients that don't have a direct primary care provider, and it's higher. It's a higher monthly amount. But if you go through your direct primary care, and if we're talking here to direct primary care doctors too, if you become an affiliate, you have a specific link that's linked to your specific practice. And that way you can give that to your patients, and patients can get that discounted amount, which is the essential membership through Zion, through your practice. So it's a great way, because I think direct primary care and Zion HealthShare is a very good pair that works together. Because what I tell patients is, us as a direct primary care can probably take care of 95% of your needs, but there's a 5% that we can't, and that's where Zion HealthShare comes into play.
Thank you guys so much for that clarification, and also really giving real world examples of how Zion is actually stepping in when access and coverage are needed. One thing I will call out: how many of us, all the doctors listening, have not taken care of ourselves, and we've taken care of our
Right.
patients, but we don't take care of ourselves, right? So this is, again, a very pertinent conversation, especially for those people who are having to look to DPC where they never thought that they would this quickly. If they've lost their jobs, if they can't do it anymore in the system, whatever it is, I would love to hear from both of you. What's the conversation like when you're talking about, hey, you're a DPC doctor, you could actually benefit from having membership with Zion as well?
So I have a great experience actually from this week. We had a DPC doctor that was in town unrelated to Zion, he came from the state of Arkansas. Came to Utah for some other meetings, but he messaged us and said, "Hey, I'm in town and I'd love to meet you." So our director of sales and I ended up going out to lunch with him, and he started the conversation by saying, "Hey, I've got to start it this way. You know, I found Zion because I'm 3 months into owning my own clinic. And I've been in traditional medicine for years, but I'm 3 months into starting my own clinic. And I was terrified because I didn't know what I was going to do for insurance. So he's like, I heard about health sharing and I looked into it. And as I compared all of them, Zion is where I landed. And I just felt like, as I read everything about you guys, I felt like I aligned really well with you." And he said, things were great. Well, again, 3 months into his membership, he had a child with an appendix burst. And he said, that was the most terrifying moment of my life because here I am. I can't take care of this. I don't have insurance. And he's like, it was the most seamless, simple process. He's like, I'm very organized. So I had read through all the guidelines. I knew exactly what would be required if I had an event. And he's like, I barely even had to think of it. And everything was taken care of. You guys have been so great. Even more important, I think it's important that I think that the physician, the doctor needs to feel like they're taken care of to be able to provide their whole self to take care of other people, right? And so we are a fantastic option for doing that, especially a new clinic, where you're taking on all this risk, and we are just such a much more affordable option when it comes to making sure that you and your family are taken care of in these unfortunate situations that arise.
What I would say is that emergencies happen to anyone. It's not a respect of person. So they can happen to doctors too. And you need some type of coverage, even if you're healthy, because the unexpected can happen to any of us. So I would say this is a great option.
Camilla is a rock star. I want to reassure everyone that we do not require that our affiliates, our DPC doctor, physicians, partners understand everything about Zion the way that Camilla does. It would be incredible if they did. But when your patients have questions, or you let them know about it and they have questions, we have an incredible team from a sales perspective, from a support perspective. We are consistently rated the top health share due to our customer service. And that is because of this incredible team that we have here that are always willing to answer questions. If you call us, you will be on the phone with an actual person. Many of our members feel more like family than they do just a member of a health share. So you have an entire team of people that are here dedicated to support you and your patients. That's what we're here for. Please feel free to send anyone our way that you feel like you need to.
So the first thing that I thought of, and I'm sure there's listeners out there thinking the same thing, I was like, that sounds a lot like DPC, huh? Like, what? Am I right or am I right? Right. So
Yep.
Right.
this is fantastic. So I am so glad that you guys joined today and that we're having this conversation. And I really, again, call out that we are talking about not only healthcare coverage for our patients who we worry about healthcare coverage on a daily basis for. We are also talking about ourselves, and we are talking about how to, like Ashton and Camilla have both mentioned, how being an affiliate with Zion can also help your members get even better access to healthcare coverage. So so if you're sitting in the audience and thinking, like, I have a lot of questions and I'm not a member yet, or I am a member and I do have questions, or any and all of the questions, we're going to be having a webinar soon for the My DPC Story community. So definitely check out the link in the show notes for how to sign up for that. If you have any questions, contact me at mydpcstory.com. And then if you're ready to do the 10 to 15 minutes to get healthcare coverage, go to zionhealthshare.org right now and, sign up. And so with that, again, I am so grateful for you guys having this conversation at a very important time in our country's history where healthcare stands right now. And I'm so glad that you guys are part of the team that is making this community so accessible for everybody.
I say Zion, of course, but health shares and direct primary care, I feel like it's a grassroots movement really to change healthcare in America from the ground up, because it's going to be very hard to change the healthcare system in our country from the top down. And I feel like we're changing healthcare for the better with this movement.
Thank you so much. We appreciate the opportunity to come on and chat and share our mission and what we do. We're enthusiastic about it, and we appreciate being partners with all of the incredible people in the DPC world that are also dedicating themselves and their skill set to making an impact in improving healthcare.
I just want to say thank you again to Ashton and Camilla for such an honest and timely conversation. Because, and I know that most of you can relate to this, so many of us in direct primary care spend our lives thinking about access and coverage for patients, but we don't always take the time to think about what happens if we are the ones who need help. So again, this episode was meant to open that conversation and to remind you that healthcare access doesn't have to mean going back to the insurance-driven system, and that there are values-aligned options like Zion HealthShare that are built to support this grassroots movement happening in medicine right now. And if you're sitting out there with questions, whether you're a DPC physician, practice owner, or someone exploring alternatives for your family, join us for the live Zion webinar on February 13th at 2 p.m. Pacific. You can register using the link in the show notes or by visiting mydpcstory.com. And if you're ready to learn more right now, you can also visit zionhealthshare.org to explore membership options. Thank you to all of our listeners for being a part of this community, and thank you for helping change healthcare from the ground up. I'll see you Sunday.